Welcome to this online tutorial entitled Infectious Diseases and Their Treatment with Soluna Remedies. For those of you unfamiliar with the Soluna Homeopathic Spagryic Remedies, we recommend you view an introduction to Soluna Remedies with Dr. Thomas K. Schultz online at www.solunalabs.com under the video section before viewing this tutorial. After viewing the introductory presentation, you will have a much better understanding of this tutorial. Let's begin. The principle of alternative medicine or biological medicine is that practitioners do not treat the symptoms or particular diagnosis, but individually evaluate and treat each patient. Each program of treatment should be tailored to the individual needs of the patient. Therefore, all patients should be evaluated through the various methods available to the practitioner with the main consideration of improving the body's ability to heal itself, and not only focus on suppression of the symptoms. With this in mind, there are general guidelines of usage when administering the Solunits that will support proper body systems with consideration of the ailment. Today, we will discuss the general guidelines for treating infectious diseases such as influenza, sinusitis and otitis, bronchitis, gastroenteritis, and finally, cystitis and pyelocystitis. Influenza is a dangerous respiratory illness caused by the influenza virus. Approximately 3 to 5 million people are affected by the influenza virus worldwide each year, with hospitalization and death possible for those in the high-risk group, consisting of the very young, elderly, or chronically ill. A biological medical approach aims to effectively stimulate the immune system while detoxifying the body to eliminate the additional burdens of toxins. Effective treatment with the Soluna Remedies begins with number 7 epidemic, which is the primary Solunit indicated for acute infections, especially those where a fever is present. In addition to number 7 epidemic, number 16 Renalin and number 9 lymphatic N are used for stimulation of the kidneys and lymphatic system. Additional supplements that may be administered include vitamin C, zinc, and probiotic therapy. Sinusitis is the infection or inflammation of the sinus cavities, while otitis is the infection or inflammation of the ear. Proper treatment with the Soluna Remedies is very similar to that of influenza, although instead of utilizing number 7 epidemic as the primary Solunit, number 3 Azenat is used. Number 3 Azenat is also indicated for infections, along with rheumatic problems. In general, number 3 Azenat may be prescribed when an infection is not associated with a fever, while number 7 epidemic may be administered when a fever is present. This is due to the related mineral in number 3 Azenat, which is iron. Just as was with the case in influenza, number 16 Renalin and number 9 lymphatic N are used for proper detoxification. Additional supplements include vitamin C, zinc, probiotic therapy, as well as symptom-specific simple homeopathic remedies. Bronchitis is a respiratory disease that results in coughing accompanied by thick phlegm and shortness of breath. Number 3 Azenat is used to stimulate the immune system, and number 16 Renalin for detoxification. Number 16 Renalin is always indicated to accelerate an expulsion process, especially with bronchitis. In the treatment of bronchitis, it is essential to utilize number 15 Pulmonic, a remedy indicated for all respiratory conditions. Number 15 Pulmonic contains ingredients such as longwort, milkwort herb, and eucalyptus leaves, all excellent expectorants. Additional beneficial supplements include vitamin C, zinc, and probiotic therapy. Viral gastroenteritis, often referred to as a stomach flu, is the inflammation of the stomach, small and large intestines that may result in vomiting, diarrhea, or both. Treatment through an alternative method utilizing the Solunits includes number 3 Azenat, number 9 lymphatic N, number 8 hepatic, and number 20 stomachic 2. Number 20 stomachic 2 is excellent for ulcerative complaints, inflammatory stomach problems, and intestinal disorders. It is commonly administered for diarrhea and can be combined with number 21 styptic N for bleeding diarrhea. Cystitis is the inflammation of the bladder commonly caused by bacterial infection and referred to as a UTI or urinary tract infection. Pyelocystitis is the inflammation of the renal pelvis and the bladder. Treatment with the Solunits generally includes number 3 Azonet as an immunostimulant to fight infections, number 9 lymphatic N combined with number 16 Renalin for proper detoxification, and number 11 Matrogen 2 for women with cystitis or pyelocystitis. Number 11 Matrogen 2 is indicated for female hormonal balance and is helpful for menstrual and uterine problems. Additional supplementation includes horsetail tea, which is known to increase urinary flow and thus help flush bacteria from the bladder. Thank you for viewing this tutorial. If you have any additional questions or would like to open a Soluna account, please call our toll-free line at 1-800-605-1798. You can also visit our website at www.solunalabs.com for more information and upcoming seminar and events.